Hey there, my name is Megan Clanahan. I am the co-owner of Houston Moms, and every month it is our pleasure to bring to you an important health topic from our friends and partners at UTMB Health. They are our preferred provider for the Bay Area, Galveston, Leak City, Pearland, all of you people in the Southeast. We love UTMB Health and their experts. And this month, and you would think we've done these almost now for about a year and a half, we have never touched on eye care for our kids. And so we thought this would be a great time to do that, especially with kiddos going back to school. We want to make sure that they're able to see and see well when they're in the classroom. And so we felt like it was a timely topic. So today I have Dr. Ehlers joining us. She is from Victoria, Texas, and she practices in Galveston, Friendswood, and one more, right?
Texas. Yep.
Okay, in Texas City. So she is all over the place. She is a pediatric optometrist, and so well-versed in all the things that we are going to discuss today. Dr. Ehlers, thank you so much for joining us.
Thank you for having me. I'm excited.
Absolutely. So just give us, I know I just gave a little bit of your background, but do you have specific interests? Tell us a little bit about yourself.
So I'm a pediatric optometrist here within UTMB in our ophthalmology department. I pursued my education at University of Houston College of Optometry and then fulfilled a one-year fellowship residency at University of Houston College of Optometry also. And that one specialized in pediatrics, special needs, and my patients who were post-traumatic brain injury and how that related to the visual system. And then I joined shortly after here with UTMB, and I've been here for almost 2 years, come in October. So,
all right,
I love it here.
Happy early anniversary.
Yeah.
Well, we know your time is precious, and so we're just going to dive right into those questions. One question I had, these eye screens that we do at school or maybe at our pediatrician office, as we're checking the kiddos out, are they enough for what our kids need?
So the vision screenings, I get this question often. Now they are vital. So I am glad that we have checkpoints within the school system annually that screen our children, and also our pediatricians that are checking them basically from birth. Your pediatricians are looking at the eyes, not only for vision, but on how the eyes work together, the eyelids, any blocked tear ducts. So I am grateful for the vision screenings. They do not replace the comprehensive eye examination, however. The vision screenings usually test for your distance vision, but then children also need near vision up close and how their eyes work together when they're doing these things. And then also the health of the eye exam inside that is not checked at a vision screening. They can also give a false sense of security to the parents that are like, my child passed the vision screening, they have no problems, and then come to find out that they actually do need glasses or they have one eye that's weaker than the other. So while they don't replace a comprehensive eye exam, they are a good part, at least to screen to catch the people that need it.
So let's say your child has had this vision screening at school. You might get a note home. How do you know when it's time to go see a specialist like yourself?
So you also, depending on where you are, have a community of optometrists. Now, if they are comfortable in seeing pediatric, they will suffice. So you would have to call your doctor and let them know, are you comfortable seeing children, especially 5 and under? Now, for a specialist, it depends if they're more at-risk populations.
What would an at-risk population be?
So patients that are born premature, or if you have a family history of a known eye problem yourself, that can be likely genetic or passed down to your children as well.
Interesting. So let's say both parents are in contacts or glasses. Are you more likely to have a child who will be in contacts or glasses?
Not always, but yes, it is more likely, especially if you and the other parent started glasses early on.
Okay. Yeah. So we're in that club. Both my husband and I'm more blind than he is, but we had a feeling we would have one, and we did. So pediatric optometry though, I mean, that's a very specialized group. Should we be making pediatric optometrist appointments just to make them, or should we only make them if we're concerned or maybe that we're at the at-risk group?
So American Academy of Optometry recommends that your first eye exam be anywhere from 6 months to 2 years old. If everything is completely normal at that eye exam, your next one would be between 3 to 5 years old. And then after that, from 6 to 17 is recommended annually.
Okay. And so you kind of talked about how often we get to see this, we need to see the specialist there. What about like kind of a basic eye doctor? Is there a reason we should go more specialty to a pediatric, or, is it okay if I take my child to my eye doctor?
It's perfectly okay as long as they are comfortable seeing children. Now for a specialist, if you have an eye turn, so an eye that turns outwards, inwards for strabismus, or if you have something more medically complex, an eye that needs surgery, you would be more likely to go to your specialist than your regular eye doctor.
Okay. Now, a question I've always wanted to know: what is the difference between an optometrist and ophthalmologist? I always get these messed up in my head, like the psychiatrist and the psychologist, right?
Yeah, it's the O words.
Mm-hmm.
No, but I think of it as your optometrist is your primary care provider. So like your pediatrician. They see the patient, diagnose for contacts, glasses, manage medical conditions. And if you're needed to see a specialist for surgery or for something more medically oriented than they're comfortable seeing, then you would see a pediatric ophthalmologist. But we do work hand in hand. So
okay. So let's say you take your child to someone like yourself, pediatric optometrist, and it's time for glasses. Or contacts or what have you. What's your next step? Where can they get prescriptions filled? All of that.
So there's so many places, local opticals around you, whether that is a large branch store, a private optical. Here at UTMB, we have one at Texas City and Galveston location. As long as you have your prescription, you can take it to a qualified vendor. Your child needs to be present so they can measure the distance between their eyes, as well as see what frame fits their face the best, and also what color they like and what they feel comfortable wearing.
It's so important. One thing I've loved seeing as it's evolved, I am a child of the 80s and I wore glasses from the time I was in second grade, but we had like the awful bubble things, and it was, now my child was actually excited to get glasses. Like, it's kind of a little fashion statement.
It's become a little more of a fashion statement lately. I have noticed that. I know I had mine, and my first one was in 4th grade, and I remember crying. My mom was like, nope, you're wearing glasses.
Yeah, I just, it's interesting, but having them try it on is for sure super important.
What do they feel confident in?
Yeah, I mean, they're going where they should be wearing them every single day. Although those are battles too, which we can kind of touch on in a bit. So beyond like your typical nearsightedness, farsightedness, and can you remind me and remind our audience, nearsighted is and farsighted?
Nearsighted is, so it's the sight you typically can see. So nearsighted means you see well up close, but you struggle with the distance portion. Okay. That's also called myopia. Farsightedness, they see okay the distance you have it far, but they struggle more up close. Also depends on the degree of it too. Really high prescriptions have trouble with anyone up close and far.
Okay. Is there one that's more prevalent than the other?
In children, farsightedness, we're all born a little bit farsighted. And as we get older, that trends down towards the 0 mark. And then that's when we become nearsighted into the myopia later on. So farsighted is more common.
Interesting. Okay. I'm definitely nearsighted, but now I'm getting old. So I'm right on the cusp of farsightedness, I guess, being able to see up close. They keep telling me I have a couple more years, so we'll see how long I hang on. But beyond the near and the farsightedness, what are some other common things that y'all would be looking for and that would need to be diagnosed at a visit?
So the ability of the eyes to work together, it's very common for an eye to drift outwards, turn inwards, and that can happen at birth, that can happen at 2, at 3. It can change as your child changes. So that's called strabismus. Also, amblyopia, very common, where amblyopia, you have one eye that has a higher prescription usually, or an eye turn that causes it to become weaker. And then the child develops better sight in the eye that is non-weak. Also, we have droopy eyelids. We have what's called ptosis. So we have children that are born with one eyelid lower than the other. That can impact their vision. Clogged tear ducts are very common in babies. And then, of course, the styes. Those are, we have like 4 of those in clinic today. The chalazions, little eye bumps on it's very common.
Isn't that wild? Okay, you're hitting on like several things that we've experienced in my house. Styes were a huge issue for my daughter. Can you speak a little bit to how you would treat a stye, since that is something that is so common?
So as soon as you see one, grab a warm compress, warm heat. Now you can do that with a wash rag with hot water, but I recommend that a little mask. You can either, there's several generic equivalents over the counter that you heat up in the microwave, make sure it's not too hot, and then press that on the bump on the lid. Warm compresses will help it be reabsorbed by the body quicker. Also keeping the eyes very clean. You can use baby shampoo, over-the-counter lid scrubs to make sure the lashes are clean. Those are the 2 most common things that you can do at home to jumpstart your treatment.
That's good, because they are incredibly painful and annoying, and I do
And they take
remember
forever to go away.
they do. And then, I mean, and their poor little eye gets so swollen. I do recall the baby shampoo and like using like a little Q-tip to just kind of clean it right there. But thankfully my kids seem to grow out of that. But there were some tedious years there. Kind of going back to what you're speaking about, one eye being weaker than the other, and then the other eye starts to basically take over for the for the weaker eye. What are some things that y'all do that might help a kiddo get out of glasses at some point if let's say one eye is good and the other eye is weaker? Are there some solutions there?
So first treatment is if they need glasses. If glasses will help that weaker eye on its own. And sometimes that's all we need, is just to correct it with glasses. We also can do patching. If glasses are needed and they're not enough, I call it the second step, is we'll use an eye patch to cover the stronger eye to therefore make the weaker eye strong. So patching, I mean, you can patch for upwards to a year. My parents struggle with that, but it really works if you do the treatment for the patching. Those are the 2 most common things that help.
So for the people who might be listening, like my daughter, they should be wearing their glasses. So then eventually they can maybe not have to wear glasses, right?
Exactly. I have in my children that have one eye that doesn't need glasses and the other one has a high prescription, their most common thing to say is, I see no different with the glasses on. And they're correct for the eye that doesn't need anything. It's looking through a plain glass, but they don't realize it's helping the other eye at the same time. So I get that complaint very often. And the parents are like, well, they didn't notice the difference, so we didn't have them wear it. The child doesn't realize that it's helping the other eye too. So
we got to power through. So parents, we got to just make sure they're wearing those glasses. I know it's been a challenge for a lot of kids, especially with masking. It's wear glasses in school. That fog is no fun. So, I mean, I get it, but I'm sure y'all are working hard to advise our parents. So speaking of school environments, what accommodations can be made for children who are suffering with their vision or some of the other things that we've talked about today?
So it depends on the level of whether they have visual impairment. And so if they fall into the visually impaired group, we work closely with the school system and also with their therapists. And they usually have a vision impaired teacher if they need devices and different accommodations for the school, whether they need to simply just sit closer or if they need larger font, different overlays that have different colors that help them. There's various options depending on what the child needs.
Okay. So that's so incredibly encouraging that you'll work with the schools and
Mhm.
say, this is what I believe, Johnny needs to be successful at school. Um, so important. So we appreciate you doing that. I know one thing that I always love about UTMB Health is that you guys really work hand in hand with comprehensive care. So
Mhm.
um, we kind of talked about it's pediatrician. We're going to do those important vision screens every
Mhm.
year. And then they can go and see a pediatric optometrist. And then assuming that everything's okay, then they're on a schedule. But if not, you have relationships with ophthalmologists, right?
I
For,
do.
the more serious things. And then y'all work hand in hand, right?
Yes, we just schedule you in the next clinic over the next day. So depending on which ophthalmologist specialty you need, which the eye is so complex on all different parts, and then I make sure that I get you to the correct provider for what your child needs.
And I love that so much, how you guys really work hand in hand. And we're definitely going to pop all the links in below of how you can find a provider at UTMB Health, whether it's with Dr. Ehlers or one of their other optometrists. And there, I know they also have adult optometry.
They
And
do.
so
We have a
we'll
lot
pop
for
those
adults.
links too, because we need to take care of our eyes. For sure. Was there anything else that you would like to mention as it relates to pediatric optometry?
Oh, what I get often is my child is too young for eye drops. It's not true. We
Okay.
dilate children right out of the NICU for premature babies. So there are drops that are safe for all ages. They'll
Do
be
you
right behind
have
you.
any tips, speaking of eye drops? So let's say your child has an infection or a scratched
Mhm.
eye. Not that it's happened in my house, but it may have. Um, any tips that you would give to a parent as to how to get those eye drops in? Because man, that can be a struggle for a lot of us.
So hopefully, if you have another person willing to help you, you can hold, someone can hold the arm, the other person can hold the eyelid. I've also found that putting in the eye drops when they're sleeping or taking a nap, they're not really aware of it, depending on how well light of a sleeper your child is, you can get in a few extra drops without them awake and knowing.
That's a really good idea. Man, like if I can slip in the tooth fairy, I should have just gone up there and put in the eye drops while they were sleeping. I think that's really sage advice. Thank you. And thank you so much for your time today. I think it's always so fun to do these chats and help provide our parents with some valuable information. Again, we will drop all the links below so you can find a provider at UTMB Health. Dr. Ehlers, thank you so much for your time
Thank you
today.
for having me. I enjoyed it.
Absolutely. And we will be back here next month with another monthly hot topic. And while we're here at that point, if you guys have something that we haven't covered and you want us to find an expert to talk to, drop that in the comments below too. We want to hear from you, what you're interested in, what we need to cover. And I'm also going to post a link of all of the videos that we've done over the past, 18 months. We've covered a lot. And so if there's anything that you have missed, then please make sure you check out those links below. But until next time, we will see you in August and stay cool. It's a little warm out there, Houston. All right. Take care. Bye-bye.